I think, ma'am, Suparna ma'am,
Yes.
I think Dr. Shubhangi should present again. I can still see that black icon.
Okay, okay. I will request her. Dr. Shubhangi, please start sharing the screen again. There seems to be some thing coming up.
Okay, okay, I'll do it. Is it fine now?
Still some portion of black that is coming. This one.
Dr. Shubhangi, can I just request you to present in the slideshow mode so that we can check once?
Is this okay?
Yeah, this is fine now. Quite better because still it is there, but it's at the top. I think it's some technical error.
Oh, okay, okay. I hope this is better.
Yeah, this one is. Thank you, Dr. Shubhangi.
Thank you.
Hello, Dr. Shubhangi.
Hello, ma'am. How are you?
I'm good. Mamta Marwa this side.
Yes, yes, I recognized.
Okay.
Thank you for joining.
Good to have you here.
Thank you.
But the PPT is not the like, you know, what you have written is not clear. You know, the bigger things are visible, but not the finer font. Okay.
Sarabjit ji, Mr. Sarabjit, sir. Sir, are you here? Sir, this is Suruchi this side. Can you hear me?
हाँ जी मैडम.
हाँ जी सर, ये स्क्रीन एक बार आप देखिए, ये किस तरह की एरर हो सकती है? There is some black icon through because of which we cannot.
नहीं अभी ठीक है क्या?
नहीं, अभी भी ठीक नहीं है. ये actually increase और decrease हो रहा है constantly.
स्क्रीन हेलो.
हाँ जी सर, I'm here.
हाँ स्क्रीन तो आपके पास ही है.
सर स्क्रीन तो हमारे पास है. सर एक चीज करिए आप, मुझे सिर्फ अनम्यूट होना है और कोई कुछ नहीं करना है. आप सिर्फ डॉक्टर शुभांगी को, डॉक्टर शुभांगी गुप्ता को को होस्ट बना दीजिए. आई थिंक या तो कोई और शेयर कर रहा है साइमल्टेनियसली. देयर इज सम एरर.
I'll tell you what the error is. The idea is कि because she's the co-host, so she is keeping on admitting the students. तो जब वो admit करती है तब ये dark आ जाता है. तो host only should admit. So अगर किसी और को host बना दो, चाहे मुझे host बना दो, I'll keep admitting.
Right sir.
मैडम मैं आपको host बना देता हूँ. मैडम.
Right sir. Right.
Just a moment. अभी बता.
हाँ. हाँ जी.
सुपर्णा मैडम आपको ना.
हाँ जी मुझे host बना दो.
एक सेकंड.
हाँ.
ठीक है मैडम. हेलो.
हाँ जी.
अभी ठीक है ना, होस्ट है.
सर अभी भी still it is there right in the center top.
नहीं क्या चीज है?
Some black kind of thing. सर जहाँ पे आप ये देखिए स्क्रीन पे U से लेके M के स्टार्टिंग तक टॉप पर एक लाइन है.
ये काला something black mark is there. 1 inch.
अभी
still is there a half a inch or something like that.
वो इसलिए क्योंकि वो आपको स्क्रीन पे नजर आ रहा होगा ना आपके. अभी देखिए.
Suparna, can I make a suggestion?
Yes, please. Yes.
Why don't you enable direct entry? We just do that article because it's impossible to go on admitting people, you know.
Okay.
There is an option in Zoom, you can enable direct entry.
हाँ जी, सरबजीत जी प्लीज ये कीजिए, डायरेक्ट एंट्री कर दीजिए प्लीज.
Because that won't disturb the speaker also.
हाँ जी सरबजीत जी वो डायरेक्ट एंट्री कर रहे हैं प्लीज.
Sir, are we audible to you? Sarabjit sir?
I'm seeing that he is not able to hear us.
Actually, there is something else also going on in
Yeah.
college. Na? He is busy with that.
Yeah.
But I think it is fine now.
Fine.
Yeah, it is fine now.
Fine now.
As of now, it
Huh?
is perfect.
Ah,
Perfect, ma'am.
fine.
So maybe Suruchi, we can start.
Yeah,
Yes,
yeah, definitely, ma'am. A very warm welcome to one and all today. We have gathered here to discuss and spread awareness about autism on the occasion of World Autism Day. To enlighten us about the same, we have Dr. Shubhangi Gupta, who is a young and dynamic medical graduate who has completed her MBBS from Kasturba Medical College, Mangalore, University of Manipal. Her passion to serve children has directed her to serve as in the pediatrics department of Saptajan Hospital as a resident doctor, and her engagement as volunteers in various NGOs. We are really honored to have you amongst us, Dr. Shubhangi Gupta. I also take an opportunity to welcome our esteemed colleagues and dear students from our own and various other colleges of the University of Delhi to widen the understanding on autism. With this, I hand over the platform to Dr. Shubhangi Gupta to share her perspective on the same. You're most welcome, Dr. Shubhangi Gupta.
Thank you so much. I hope I'm audible and visible.
Yes, you are.
Okay. Thank you. Could someone please enable open entry because I'm again getting this entry requests. If that is possible, please.
Sarabjit sir, can you please make me co-host, me or Ashima, Dr. Ashima Sharma? Then we'll be
I'm
able
admitting
to do
side by side. What Nimi suggested, if he can give a free access.
मैडम ये जो कंट्रोल है ना वो आपके पास है.
नहीं आप ना इसको वो फ्री कर
मैडम आप
दीजिए.
होस्ट है ना.
मैं तो कर ही रही हूँ लेकिन आप साथ में ये कर सकते हैं ना, ये ऑप्शन भी है ना कि anybody can enter themselves.
मैडम वो होस्ट से कर सकते हैं आप.
अच्छा मैं होस्ट से कर सकती हूँ.
हाँ आप होस्ट है ना, अब होस्ट नहीं है ना हमारे पास में.
ओके तो उसमें मुझे कैसे करना है, उसमें मुझे कैसे करना है जरा बताएंगे.
सरबजीत सर एक बार जरा गाइड कर दीजिए.
कर दो मैडम जरा. नहीं प्रॉब्लम आ क्या रही है अभी तो ठीक आ रहा है.
नहीं सर वही ब्लैक आ रहा है जो अभी आपसे बताया था. इट इज बीइंग सजेस्टेड बाय एस्टीम्ड कॉलीग ऑफ आवर्स.
वो जो व्यू है ना, आप मेरी बात सुनिए, वो जो व्यू है वो आपके पास है. आप उसको व्यू में प्रेस कीजिए, बाजू में आ रहा है उसको स्टैंडर्ड कीजिए.
हाँ जी
फुल स्क्रीन कीजिए उसको व्यू को. वो तो जो आप देख रहे हैं ना उनको आ रहा है. आप फुल स्क्रीन कीजिए ना व्यू को.
फिट टू विंडो किया हुआ है सर.
हाँ व्यू में फुल स्क्रीन में देखिए.
हाँ जी तब भी आ रहा है सर. एग्जिट फुल स्क्रीन कर रहे हैं तब भी आ रहा है. फिट टू विंडो कर रहे हैं तब भी आ रहा है.
सेम विद मी.
एक काम करते हैं, मैं मीटिंग दोबारा स्टार्ट कर लूं. उनको को होस्ट तो मैडम है, सिर्फ मैडम ही कर रही है, शुभांगी मैडम जो है. सिर्फ वही को स्क्रीन शेयर करनी है, दूसरा तो कोई नहीं कर रहा।
प्रॉब्लम ये हो रही है कि वो उसको एडमिट भी करना पड़ रहा है, मैं भी कर रही हूँ, लेकिन सिंस मेनी पीपल आर ज्वाइनिंग तो उसको एडमिट भी करना पड़ रहा है। अगर ये एडमिट अगर आप मुझे होस्ट बना के हटाकर आप आशिमा को या जागृति को होस्ट बना दें और फिर वो इस तरह से कर दें कि पीपल कैन कीप ज्वाइनिंग इन विदाउट आवर एडमिटिंग देम।
मैडम आप ना सुपर्णा मैडम
जी,
आप आशिमा मैडम के ऊपर अपना वो कर्सर ले जाइए, उसमें मोर लिखा आएगा आगे।
अच्छा,
मोर को प्रेस कीजिए, उसमें मेक होस्ट कर दीजिए, होस्ट आशिमा मैडम बन जाएंगी। अब आप होस्ट और को होस्ट बना सकते हैं, हम नहीं बना सकते ना।
मोर का ऑप्शन तो आ ही नहीं रहा।
नहीं, नीचे पार्टिसिपेंट में जाइए
मैम,
पार्टिसिपेंट प्रेस कीजिए ना पहले।
क्या प्रेस करना है?
पार्टिसिपेंट्स लिस्ट।
हाँ, पार्टिसिपेंट्स पे तो मैं हूँ, आशिमा शर्मा को। अच्छा, अब मैं क्या कर रही हूँ? मेक होस्ट। ओके,
मोर आ जाएगा उसमें।
ठीक है,
हाँ जी,
अब हो गया ना?
अब आप होस्ट हो गई, ठीक है मैडम।
अब आशिमा आप देख लीजिए, फ्री एंट्री दे दीजिए।
ठीक है, ठीक है मैम।
काम करो ना। क्या? हाँ, वहाँ डाल लो ना, या उसका कीबोर्ड ले आओ, अपना फटाफट ले आओ।
Thank you everyone for joining. There are certain technical glitches. We'll be starting shortly. Sarabjit ji, kindly mute yourself. Ashima, are you able to find out what the problem is?
Yes, ma'am. I'm making it co-host. I think we can proceed. I'll manage. I'll be working now since I'm the co-host. I'll take care of it.
All right. Maybe we can start. We can start. Okay.
Shall I start?
Yes, please.
Yes, please, Dr. Shubhangi. Sorry for the technical glitches.
No worries, no worries. Hello everyone, I am Dr. Shubhangi Gupta, currently working as a junior resident in the Department of Pediatrics at Safdarjung Hospital, Delhi. I would like to thank the principal of Shyama Prasad Mukherjee College, Professor Sadhna Sharma. Thank you, ma'am, for giving me this esteemed opportunity to talk about autism, a subject that is really close to my heart. I would also like to thank the Family Counseling Center of SPM College and all of you participants who have gathered here today. Thank you for sparing your valuable time today on this day of 2nd April, celebrated as the World Autism Awareness Day. So the World Autism Awareness Day, as initiated by the United Nations, is observed annually on 2nd April to raise awareness amongst its citizens about autism spectrum disorder throughout the globe, so that we can develop an understanding, a compassion, and acceptance of these people in our society to have a more inclusive and accepting society. So the ribbon that you see here, this is a puzzle ribbon. So this puzzle ribbon has been adopted as the universal sign of autism. Why? Because this puzzle reflects the complexity of what actually autism is. So we see a variety of colors and a variety of shapes in this puzzle, which represents the diversity of people and the families that are living with autism. And the bright, vibrant colors signifies hope. And the theme for this year, 2022, is inclusive quality of education for all. So there is the vision to leave no one behind. So I would like to touch upon the prevalence of autism. So according to the Center of Disease Control statistics data of 2018, about 1 in 44 children have been identified with autism spectrum disorder worldwide, and it is 4 times more common in boys than girls. Coming to Indian statistics, according to a population-based study among 5 regions of India conducted in 2018 on neurodevelopmental disorders in children aged 2 to 9, about 1 in 100 children in India under the age of 10 has autism, and nearly 1 in 8 has at least one neurodevelopment disorder. ASD prevalence in India is comparable to the published global literature. And the most risk factors of neurodevelopmental disorders are seen to be modifiable and amenable to public health interventions. So I'm sure that all of you must remember these amazing Bollywood movies, huh? So in Koi Mil Gaya, we remember Hrithik Roshan's character as the autistic child Rohit Mehra, who was bullied in school because of being different. And he was facing his own challenges in life and how he was unable to interact with his peers. But this movie, although it is based in a fantasy fiction, but it gave us the message that how important it is for us to love and accept everyone in society. Then coming to this movie, My Name is Khan, I'm sure all of you remember the character of Rizwan. Huh? He actually suffered from Asperger's syndrome, which is one of the part of autism spectrum disorder. It comes on the spectrum, and I will talk about it more in the subsequent slides. And we saw that how, he, despite having problems with interacting and, social communication and talking in society, he still gathered his courage, ventured out in the world to find out the truth about his son's death and how he was applauded worldwide. Then coming to Burfi, so Priyanka Chopra's character, Jhilmil, shows the movie depicted the trials and tribulations of an autistic child and how they interact in the world. And it showed that they also go through feelings and emotions and how important it is for us to have an accepting society. So coming to autism, so what is autism? It is in two parts. The prefix aut, which means self, and ism, the suffix, which means a state of being or a condition. और हिंदी में हम इसे बोलते हैं स्वलीनता. स्व मतलब अपना, लीनता मतलब मगन होना. तो मतलब वो अपनी ही दुनिया में मगन रहते हैं, स्वलीनता. And this meaning, this autism meaning self and a state of being, so they remove themselves from the surrounding and the social and the community, and they're isolated in their own world. And this definition that it is a pervasive means it is widespread, neurological to do with the brain, developmental disorder that is to do with the developmental milestones starting as a child, which manifests itself early in life, usually before the age of 3. It prevails through a person's life and is significantly atypical for a child's mental age or developmental level. So it means that it stays throughout his life and it is not typical of his mental age or developmental level. So I would like to explain this by revisiting the developmental milestones. So I want all of you to revisit the developmental milestones with me. So at 2 to 3 months, a child starts having the social smile. He recognizes the mother. He smiles at the mother. He maintains eye contact while talking. He recognizes the mother and he shows interest in the surroundings. So these are the features of a typical child at the age of 2 to 3 months. But a child that is suffering with autism won't be able to show this kind of interaction with his mother. He won't show social smile. He won't respond to the mother. At around 6 months, a child shows his likes and dislikes. He starts developing stranger anxiety. He smiles at his own mirror image. These are the features of a typical child, which will not be seen in a child with autism. At 9 months, a child starts waving bye-bye. He makes noises. He makes facial expressions. He does attention-seeking activities to grab the attention of the mother. These are all features of a typical child at the age of 9 months, which you will see in an autistic child. He will not involve in those interactions. He won't wave bye-bye. He won't, have those interactions via gestures with his parents. At the age of 1 year, a child starts getting involved in pretend play. He plays peekaboo, he giggles, he shows hand gestures. So he makes 1 to 2 words with meaning. So we will see that a child who's suffering with autism won't make meaningful words. He won't interact. He won't get involved in these kind of playful activities or group play. He will not show interaction with people. Rather, he will show more interaction with objects and toys. He will not like being cuddled, being hugged, being picked up. So these are the subtle signs which we will see, as the development progresses. At the age of 18 months to 2 years, a typical child responds to the surroundings, responds to the people in the surrounding. He shows appreciation, shows affection. He points to objects, fan, he will point to objects. He will point to pictures, point to his body parts. He will start talking in 2-word sentences. So these are the features of a typical child, which a child suffering from autism might not show. So I have a few images about depicting the same. So this is a child who is not holding up object to show to the adult, not imitating gestures, not doing bye-bye. He's only playing with his favorite toys, not interested in people. He's not producing any babbling sounds, not pointing to ask for things, not imitating actions. We usually see now that kids, small babies, they imitate the actions of the parents, but child suffering from autism won't do that. He won't respond to his own name when called. He will be involved in his own world. Then he will not make an eye contact while communicating, and he will be not interested in talking to people. He will be rather interested in playing with his own toys. So these are the symptoms which you will see as the milestones progress, and these are the subtle and early signs which will be noticeable in these kids. Now, autism is characterized by this triad of difficulty in the 3 domains. So these 3 domains are social, interaction, language and communication, that is both verbal and non-verbal, and patterns of behavior, which are actually stereotypical and repetitive patterns. So earlier we followed the DSM-4 criteria. So the DSM-4 criteria actually told that there should be a minimal number of symptoms in all these 3 domains to be labeled, for a child to be labeled as autism spectrum disorder. But according to the guidelines of DSM-5, they have clubbed these 2 domains. So the social interaction and language and communication have been clubbed into a single domain. So for a child to be labeled as having autism spectrum disorder, he must show minimum number of symptoms in these 2 domains, that is social and language being one and the patterns of behavior being the other. So autistic people have differences in the following areas. What are those? Social communication and social interaction, social imagination and flexibility of thought, restricted repetitive interests or activities, restricted repetitive patterns of behavior, and unusual sensory responses. I will be telling in detail about each of them. So first, coming to social skills. So what are the aspects of social skills that will be lacking in an autistic child? So they will have difficulty developing non-verbal communication. So communication can be verbal and non-verbal. Verbal is via words, and non-verbal is via gestures. So suppose, you come across a child, he will not make eye contact with you. He will not show any gestures. He will have a flat or inappropriate facial expression. There will be inability to interpret another person's expression. So basically his interaction with the surrounding in the terms of gestures will be lacking. For example, if he wants to be picked up, he won't show babies do this to pick me up. Or if you want to shake hand with them, you will stretch your hand. He won't shake hands, a high five. He won't get involved in all those gestures. He prefers to play alone and fails to establish friendship with his peers. So if you see a group of children playing, he will not get involved in that group. He will be playing alone in a corner with his own toys, involved in his own world. He won't establish friendship with peers. He won't interact with them. There will be lack of empathy and difficulty understanding people's feelings like pain and sorrow. So they are unable to understand the feelings and emotions of people around them, and they have difficulty understanding those feelings. For example, if a child gets hurt while playing, so all the other children will gather around him, form a circle, ask him what happened. But this child will be involved in his own world, playing with his own toys. He won't be bothered and affected by what is happening in the surroundings. Then he does not readily share his interests, enjoyments, or achievements with other people. So if you see like a typical child, if he makes a painting or a drawing, he'll be very excited. He will go to his parents or teachers, look, I made this drawing. But for a child suffering with autism, he won't engage in such interests or not go up to people to share his interests or enjoyments. He might approach adults only when he needs something. Coming to those were the social skills. Coming to the communication skills. So there is a delay or a lack of spoken language. So a lack of spoken language is that he will become non-verbal. He won't respond. Suppose you are asking him, how was your day? What did you do? Kaisa raha? So he won't respond. He will continue making his own noises, but he won't engage in a conversation with you. Similarly, there can be delay in language. That is, instead of saying the whole sentence, they will say just one word. For example, instead of saying, I want to play with a puzzle, he will just say puzzle, puzzle. So they will not have complete sentences. Then this is a very characteristic feature which they show of repeating words or phrases they hear called epolalia. So they will continue repeating the words or phrases. Suppose you ask them a question, what number is this? So instead of answering it, they will repeat the question, what number is this? What number is this? What number is this? So they will repeat those words and phrases. This is echolalia. And they might also repeat words and phrases of their favorite songs or movies, but this repetition is actually characteristic. Then they're oversensitive to sounds and noises. They use odd words to communicate, and they have problems taking steps to start a conversation. So it is very difficult for them to sustain a conversation, to actively engage in one. If you want to try to communicate with them that how was your school, what did you do, how was your day, they won't get involved in this conversation. They'll be busy in their own world. And then they have difficulty understanding the listener's perspective, what we are trying to convey, what we are trying to express. They won't understand the other person and nor will be able to express themselves. Coming to their behavioral skills, they show repetitive motions or unusual behaviors, which is called as stereotypy or stimming. So this repetitive motion is basically self-stimulatory behavior. And by doing this self-stimulatory behavior, they actually, have pleasurable sensory inputs that actually gives them pleasure and satisfaction. So these stereotypy or stimming behaviors can be in all domains. So it can be in the form of bodily movements. So if you see, they will be, flapping their hands, or they might, spin around, flap their hands, walk on tiptoes. So these are the repetitive bodily movements. They can also show repetitive movements in the motions in visual. They might show gazing, or they might repeatedly see an object falling down. They can be, in the tactile, that they might keep touching this particular object, or in the term of smell, they might keep smelling their hands. So this repetitive motions or unusual behaviors is called stimming. Then they can show extreme sensitivity and may scream, grab out, or act out to express their needs. Because they're not able to express themselves in a typical way, they act out in situations. They have extreme sensitivity to loud noises, to sounds, to lights, and they can even scream out or, basically act out. Now, this is very important that they have a rigid following of routine with extreme inflexibility to changes. So they're very particular. They have to have a routine. They have to sit on the same chair every day. They want to have water from the same cup. They want to go to school by the same routine. So they're very fixated on a routine because that routine gives them stability. It gives them, it helps them. This routine actually helps them cope with the situations, cope with the surroundings. And they're very inflexible to changes. They avoid changes and want to follow a routine. They may show overly focused interests and preoccupation with objects. So they love playing with toys, and they are very passionate about certain subjects and topics, like about trains or cars. And you can see them that they will go on talking about that topic. And instead of, being fixated with the whole thing, like suppose if a child is playing with a car, you will actually see him spinning the wheel. So he will have preoccupation with a certain part of the object. So those were the three domains. They also have some unusual sensory responses. So a few examples can be that they can obtain sensory joy from certain colors, from feeling certain materials. They can have decreased feelings of pain, sensitivity to lighting, dislike of certain colors, in fact, then difficulties in noisy traffic, inability to tolerate certain smells, distress or anxiety in busy environments, and sensitivity to touch. So these are some of the unusual sensory responses because all their senses are heightened. And which can lead to them having a sensory overload and an unusual sensory response. So here is a video clip which I want all of you to see. So this is a small child named Alistair. I have taken this video from YouTube, and so this child is actually, he looks like a normal, healthy, playful child, but actually he has early signs of autism and some of the features which I have told you about. I hope you like this video. So this is a child, Alistair, like a typical happy, healthy boy. So first we see that he shows hand flapping. This movement is hand flapping, repetitive movement. Then frequently walking on tiptoes. So these are all the bodily movements which I told you about. The repetitive movements, stimming, head banging. Then consistent fuzziness or screaming because they're unable to express themselves in a typical way. So they act out, they become aggressive, they start crying, because they're not able to express themselves. Then this is another example of repeated things, pouring drinks back and forth, repetitive motions. And because they feel trapped, they become aggressive at times, biting, and violent behavior. Then they lack response to voice or verbal commands. When they're called their name, they won't respond. They're in their own world. They avoid eye contact. If somebody is interacting with them, they won't make an eye contact. Busy in their own toys, in their own world. They lack speech and communication. See that the person is trying to talk to him, but he's playing with his own object. And they can have problems with food, texture, and clothing. And this is Connor, who is Alistair's brother, and he also has ASD. So this was a small video clip. Okay, so coming to autism spectrum disorder. So autism, actually a more correct term is saying autism spectrum disorder rather than calling it autism, because this is an umbrella term which has been included under DSM-5. And it says that it is based on the severity level, and it is a spectrum that varies over severity based on those criteria of social interaction, communication, and repetitive behavior. And it recognizes that, it is not a single disorder, it is a spectrum. And each individual has unique symptoms on the spectrum and unique skills and characteristics. So not each person with autism or autism spectrum disorder is the same. They will have different characteristics, a different skill set, a different set of symptoms. So I would like to touch upon each of them, like autistic disorder we just talked about. Asperger's disorder is the one that, Shah Rukh Khan had, Rizwan's character in My Name is Khan. So this is also called as high functioning disorder, because although some signs of autism are seen, like, problem in social interaction or non-verbal communication, but at the same time, the language and cognitive skills are not affected. So because of that, they can excel in certain subjects. Like Rizwan, in fact, remember he used to hold that symbol, can fix anything. He was a great mechanic. So that's a high functioning disorder. They have special skill set. Then coming to, that's why it's called a high functioning disorder. Then coming to childhood disintegrative disorder. So this is also a rare, it is a late onset disorder, where there is, it is characterized by regression. So by 2 to 10 years of age, they start losing the milestones. So they might earlier be, playing, talking, but after 2 to 10 years, they will start losing interest in playing. They will start losing their motor skills. So this is characterized by regression, disintegrative disorder. Rett's disorder is another rare disorder, which is mostly seen in girls. And Rett's disorder is predominantly characterized by muscle atrophy and also repetitive hand movements. So if you see a Rett's child, she will, be like this, or repetitive hand movements she will be showing. And you will also see orthopedic problems associated because it has muscle atrophy. And predominantly, these children also show intellectual disability. Pervasive developmental disorder, not otherwise specified, is also very similar to classical autistic disorder with minor differences, and the interventions and treatments are the same, and the minor differences are observable to researchers and doctors. Okay, so coming to the causes of autism, I would like to stress here that there is no single cause of autism. We can't, equate 1 + 1 is 2. There is no single cause of autism. It is multifactorial, and various causes, various associations are seen with autism without a single causative factor. So these are all the researches and studies which have been done, and these associations have been established. There is no single factor that causes autism, and it is very important to understand so that we can destigmatize it. So it can be broadly divided into patient and family related factors and environmental factors. So, patient and family related factors could be the older age of parents. And again, it is not always true. Like, it doesn't mean that always an older age parent will have autism. So these are some of the associations. And also there is recurrence seen in subsequent pregnancies. Then there can be genetic factors. Genetic factors is the area of the brain that is associated with social interaction and communication, that area of the brain is affected. So the particular genes have not been identified, but it has been seen that the synaptic connections are affected. And these genetic factors play a role because it is seen that it is, around 7% chance of reoccurrence in a sibling. Then gastrointestinal, also a syndrome called as the Fragile X syndrome also shows more occurrence of autism. Gastrointestinal problems in children are seen more with autism than typically developing children. Now, there are some prenatal factors which have been shown to be associated with autism, such as it could be low birth weight, hypoxia. Now, diabetes in the mother, there is something called gestational diabetes mellitus, which when a mother develops diabetes during pregnancy, that has also been shown. Then there's some infections, prenatal exposure to rubella, cytomegalovirus. This is because this can actually activate the mother's immune system and increase the chance of autism. Then there can also be, if there is thyroid problem in a mother at the around age of, around 8 to 12 weeks of gestation, that can also have changes on fetal brain, prenatal stress like family discord or job loss. So these are some of the prenatal factors. Postnatal factors can be a child can have gastrointestinal or immune system abnormalities, allergies, exposure of the child to drugs. Now, the vaccine is still under dispute and there is no as such solid evidence about vaccine causing it, but some infections that I talked about have been shown to have association. Then heavy metal toxicity like lead and mercury has shown that high blood levels of lead are seen in people with autism, and some electromagnetic or radiation toxicity has also been seen. So coming to diagnosis and assessment. So, what is the course typically? So a parent sees his child, he's not following the developmental milestones, he has delayed milestones or not interacting with them. So after first screening is done by the parents. And after that, they will bring the patient, bring the child to a physician, to a psychologist, to, educational professionals, to come to a diagnosis. And this diagnosis and assessment can be broadly classified into three. First is the medical diagnosis. So medical diagnosis is the one which is done by the physician according to the DSM-5 diagnostic criteria that I talked about, that, the social and communication skills and also the behavior in those three domains. So it is done by developmental screening during a well-child visit and followed by a comprehensive evaluation by a multidisciplinary team. So in fact, the American Academy of Pediatrics actually says that all children should be screened for autism spectrum disorder at 18 to 24 months. They have made it compulsory. So this, at the well-child visit, the first screening is the developmental screening to see if the developmental milestones were reached on time. And this can be done only with the help of parents by taking history from them. If they have recorded any videotapes or they have photos or they've made a chart out of it. So this can be done. And then there can be a comprehensive evaluation by a multidisciplinary team. And there are many screening tools which are used for that, into which I'm not going into the details, but yeah. Then the second aspect is educational diagnosis. And this is done by a team of school professionals. So a student is assessed in these areas of social functioning and communication. So what are the areas where, he can be assessed? Visual motor limitations does he have? His affective expression, his motor and verbal behaviors, fine and gross motor, cognitive behavior, his expressive receptive language. And based on all this assessment, they can analyze, does he need special education? Can he be integrated into the normal school? And this is done for a holistic approach. Then coming to a differential diagnosis. So what is a differential diagnosis? That, you rule out the things which are similar to this and come to a diagnosis so that you can properly plan an intervention. So there are other diagnoses such as intellectual disability, learning and language difficulties like dyslexia, specific developmental disorders, which might be difficult to distinguish from autism spectrum disorder because they have overlapping features. But it is very important for us to identify those clinical signs and symptoms and form a diagnosis so that we can properly plan an intervention. Coming to the management, as we know, there is no cure for autism, but there is a range of specialized interventions which can help improve the quality of life. So it has been seen that no matter people of which skill set, what age and what level of ability, if a proper specialized interventions are planned, it can actually help them to improve their quality of life and improve their functional status. And it is very important to have an early diagnosis because earlier the diagnosis, that is at the level of preschool, if we make a diagnosis and start early intervention, we can actually improve their quality of life to a significant level. So some of the approaches in management can be behavioral approaches. So here is applied behavior analysis. So applied behavior analysis is basically reinforcing positive behavior and removing the unwanted, the negative behavior. So this is done to increase their skills in language, play, socialization, and decreasing the behaviors which interfere with their learning. So it is positive reinforcement basically. Cognitive-based therapy is focusing on connection between thoughts, feelings, and behaviors. So it is the whole team comes together, the therapist, the child which has ASD, and the parent. They come together, they form specific goals for therapy. Then is early intervention programs. Early intervention programs can be family training. So family training is basically a parent-mediated therapy where the parent is offered support and he is given training in how to deal with the child, so that at the home level, the parents can manage their child. And this also has been seen to reduce maternal depression and actually increase the functionality of the children, because they best interact with their parents. Then there is speech and language therapy. So speech and language therapy is basically done, to help the child improve their communication. So both verbal and non-verbal communication, that is, they're able to communicate in sentences, express their feelings, try to understand the other person's feelings, the basic speech and language in the form of verbal communication, and non-verbal in the form of gestures, in the form of, sign language. So this is all done with the help of various methods, like visual methods can be used, like, singing can be used, symbols, pictures, basically to help them having a better functional level in the level of speech and language. Then there is occupational therapy. So occupational therapy is basically, can help people of any age to improve their ability to actually perform tasks of daily living and working environment. So those tasks can be like basic dressing, cooking, working on a computer. So basically the basic skill set. So occupational therapy in the form of physical therapy, and to improve their motor skills, or sensory integration therapy, where their senses are, adapted to, so that they can filter out what are the unnecessary sensory inputs and have a sensory integration so that they can improve their functional level in society and can work. Occupational therapy. Then there is educational approach. So in educational approach, there is to reduce sensory overload. So what is sensory overload? Basically, all their 5 senses are hyperactive. They're on full drive. So example is they're in a busy room. There are multiple people talking. There is music playing in the background. So everything kind of adds up for them. And they become really overwhelmed. And you can maybe see them, shutting their ears and eyes, and it can get really overwhelming for them. So, and can also produce anxiety. So by reducing that sensory overload, making the environment suitable for them, providing them with a structured routine, because we saw they thrive on routine. So giving them a plan, a structure of their day, a routine, using visuals, because they have visual thinking, building in breaks so that they're comfortable in the environment, teaching them social skills directly, because it is very important for them to develop social skills, celebrate their successes, small and large, so that they feel encouraged. And there is this TEACH program, which is treatment and education of autism and related communication for handicapped children. So this was a TEACH classrooms were developed, which is not followed currently, but a TEACH classroom had separate areas for play, for group activities, and the child had to go from one area to the other. But it was seen that children with autism were having difficulties to switch from one area to other without having a proper routine, and thus it was discontinued, but this was one of the approach. Then there are medications for co-occurring symptoms, that it is usually seen that, autism is associated with ADHD, that is, attention deficit hyperactivity disorder. Then they can have anxiety, then they can have some epileptic fits. So medications can help for these co-occurring symptoms so that they can have a better quality of life. And then there is the stem cell therapy. So stem cell therapy is a novel and effective approach to ASD. And it is a treatment which is based on stem cells. So the ability of stem cells to actually regenerate and replace the damaged cells and tissues. So this can actually help improve the immune system, the gastrointestinal system, and the neurological system. So it is seen that children who have been treated with stem cell therapy actually have better digestion, they have better behaviors, they have less fear in an environment. And But all these therapies, like even stem cell therapy, has a different response in different children, and it is very important for us to have an integrative approach and to understand that not all children will, respond in a similar way. So let us, we have seen all the signs and symptoms of children with autism, but what are their strengths? Let us actually focus on their strengths and the positives out of it. So they have unusual ability to focus, attend to detail, and remember facts, experiences, and conversations. So if you see a child with autism, he'll be very focused on his motive. He won't, waste time. He won't get involved in socialization or small talk, and he will be very focused on his motive. In fact, companies hire such people so that they're more efficient. Spotting details, they're very detail oriented. So they actually hire them for example, if there are any errors in coding, computer coding, or grammatical errors or errors in editing, because they focus those details. They do not look at a whole picture like typical neurotypical people like us do, like, seeing the whole picture. They actually focus on details. So they're very, very efficient. Then they have strong long-term memory skills. There is something called as a working memory, and there's something called a declarative memory. So declarative memory is something which, if they read about a topic, they will always remember it. Working memory is like, I will call you tomorrow, but you might forget. So they might forget to call you the other day, but they will not forget something that they read about. So they have a long-term memory. They're very good at math, computer, musical, artistic skills because they're very efficient. Then they are thinking in a visual way. So visual thinking, that the words actually they think in the form of visuals and pictures, and because of that they're so creative and artistic because they have a visual thinking. They have something called hyperlexia, that is, they can decode written language at an early age. Some children with autism can decode written language even before they can comprehend it. So as early as 2 years, they might be able to read the whole sentence. They won't know what it means, but they will be able to read it. They have a directness or strong moral compass, honesty, loyalty, punctuality, and reliability. So they won't beat around the bush. They won't use sarcasms. They won't appeal to your emotional sense. They will be direct, and they will have a strong moral compass. If they see someone who's getting bullied in school, they will be honest. They will stand up to it. They won't think what repercussion it will have on them. So they're honest. They're loyal. If they say something, they will do it. They are high on routine. So they'll be punctual. They'll always be on time, and you can always rely on them. Although it is a spectrum and everybody lies on a different scale of intelligence, but they usually have average to above average intelligence, and they're actually an asset. They have extensive knowledge resulting from deep study. As we already said, they go full on. So they have extensive knowledge of the topic that they are efficient in. And understanding rules and sequences, again, because they love routine and rules and sequences. In fact, I was, reading the story about a mom whose both her kids had autism, and she said that they don't argue because they're so particular. They will divide their food into half. They will have their separate places. They're very particular, always in order, always following rules. So they're always particular. And they have logical thinking that is helpful in decision-making process. So, they have objective thinking. If you go to them with a problem, they will analyze all the facts and give you a solid solution. They won't beat around the bush. So they have logical thinking, and that can really help in decision-making. So these are some of their assets: visual skills, attention to detail, creativity, integrity, analytical skills, observational skills, memory, expertise, deep focus, critical thinking, tenacity, resilience, and kindness. So how can we help? How can we as a society, as neurotypical people, help them? We can learn and be aware about autism and the difficulties that are experienced for them, because it is very important for us to first understand what they are going through. Then we can speak about the issues and challenges and spread information and awareness about autism. We can talk to our friends. We can tell society that, what autism is all about. We can be understanding. People with autism have a lot to offer, but they need support. Spend time with them and connect them to other support groups. So if we happen to encounter someone with autism, let us not judge them. Let us be understanding, support them, and help them connect to other support groups if we know of. We could also, contribute a bit by raising some funds, information on their therapies, provide them with positive reinforcement, volunteer in campaigns, talk about our own experiences to remove stigma, basically ensure that they are respected like everyone else. Then try to adapt the environment to decrease sensory issues, as we addressed that they sometimes can go into sensory overload. So we can try to make the environment more adaptable for them. We can decrease the noise, dim the lighting, find a quiet space, make them comfortable, and adapt our communication style. For example, we can speak slowly and clearly, not use idioms or metaphors, allow time for the person to process the information, keep instructions short, and avoid relying on gesture, facial expression, or tone of voice. So we can basically help them communicate better. So in the end, these are some of the famous people. These are the success stories on autism spectrum. I'm sure, we must have heard about these three, especially Albert Einstein, Sir Isaac Newton. So these are some of the success stories which show that actually people with autism spectrum disorder can achieve great heights if they are supported and included in the society. Thank you very much. In the end, I would like to say that, let us not, just celebrate this day of autism awareness on a single day once a year. Let us celebrate these differences every day. Let us celebrate and respect people suffering from autism, and let us enable them to have access to the best chances that they actually deserve and to have a very inclusive society. Thank you very much. Thank you. The ground is open for questions and answers. If there are any questions, please feel free to ask.
Good afternoon, ma'am.
Good afternoon.
Ma'am, I have a question.
Yes, please.
How do we normalize their existence without making them feel pitied? Because we often end up sympathizing with them instead of empathizing.
Yes. So it is very important to not pity them, first of all. They are like all of us. They are different, but it is very important for us to accept them. So as I said in my previous slide, what can we do? We can interact with them. We can help them, make the surroundings more better for them. Like we can, by interacting with them, we can judge that are they comfortable in the situation? Are the lights too bright? Is the noise too loud? We can reduce the sensory stimulation, talk to them, sit with them, have a conversation. We need to, I know it is very natural to have pity, to, have that feeling of, oh, he's suffering, and, but it is very important to not look them through the lens of, somebody who's suffering, but actually treat them as equals and understand that their differences make them unique. It makes them special. They have a special skill set. They're different. They're not weak. And when we have this understanding, we actually respect them as equals and try to understand them, interact with them. When we interact with them, we will actually be able to adapt ourselves according to them. We will be able to communicate with them. And, I know it's easy to say, then do it, but it's a process. And, just like, everything comes with experience. When we start interacting, coming across these people, we will eventually learn how to do it. And it's all a process, and eventually we will reach there.
Thank you, ma'am.
Thank you.
Thank you so much, Sinjan, for your question. If anyone else wants to have a question, you can go on.
I had a question.
Yes.
Good morning, ma'am. Ma'am, since I have heard all the conversations and everything, so I know how, as a teacher, since I am pursuing Bachelor of Education, so in order to make my classroom inclusive, I got the points. But I want to know, how can I make sure peer recognition in my classroom?
Okay, so basically, like, how you make sure that they interact with each other?
Yeah, yes, ma'am.
Okay, so, an autistic child, it is very difficult for an autistic child to make him interact with his peers. As I just told you, that he is, usually involved in his own world, playing with his own toys. So I feel that we should not enforce it upon them. We should not force them to get involved in group play or peer play, because it is very difficult for him to interact with them. he will not be comfortable. He will not be able to gauge that what the other person's emotions, or express himself. So it is very important to give him time. It is again a process. We can first start with giving him playing with him on one-to-one basis, and understanding his level. So every child is not the same. Every child will have a different skill set. Every child will have a different level of interaction. Maybe a child who has a minor symptom is able to interact with his peers, is able to play, but another child can have more severe symptoms and will not be involved in peer engagement at all. So it's okay. It is important to give them time and first understand that what suits them, what makes them comfortable. We should not enforce anything upon them. I know, we want them to get integrated into the society, be able to talk to his friends and engage and play with them. But everything has to be done, in a proper manner, in a proper process. We cannot enforce anything, because in that way he might start acting out. He might feel suffocated. He might, because he won't be able to express it. If we have a problem, we can express it, but he won't be able to express it, and he might show it in violence and aggressiveness. So it is very difficult and sensitive to handle them. But again, we should take help of medical professionals, educational, school professionals who handle such people, so that we can actually help them interact with the community, on a later scale. But you can actually seek help from groups which are dealing with people with autism, to help him interact with his peers. But right now, do not enforce anything upon him.
Right, ma'am, right. Also, ma'am, just one more thing that I got about whatever you were, trying to exclaim. So here, if I say that if I'm dealing with students who are in grade, say 4 or 5 or probably 6, so there, how do I create awareness about autism? Because I don't want the other children to bully that child or put them down in any way.
I understand your concern, and these are very sensitive issues actually, but I would like to say that, at this age, class 4th, 6th, is actually a very difficult time for a child. A neurotypical child, forget about a child with difficulty, even a neurotypical child, that classroom age 4 to 6th, is a period where, he's bullied and his friends will tease him and everything. So it is, we should try not to be very overprotective, because sometimes it can act in a counterproductive way. But at the same time, ensure that he is comfortable. So this can only happen by raising awareness. So maybe take a class, plan some activities on autism. If you can take the children to some place where there are people living with autism, students with autism are there. You can make them interact with them, make them aware, sensitize them about their issues, so that they don't ridicule them, they don't bully them, they don't tease them because they're different, but actually they can accept them. And this bullying thing is very difficult to stop, but all we can do is try and raise awareness by in different ways, by planning some activities, or paintings or drawing, or sensitizing them about such issues. And we can also take the help of parents, because parents play a huge role in making the child understand and his interaction in the society. So it all comes down to having an acceptance and having this awareness about autism. So the more the people are aware that this is a condition, and that this is nothing abnormal, and how we need to accept it and make it inclusive, only then we can, when we are ourselves aware, teach the children, and then only we can become a better society. But for bullying, you can try to educate them and really help them to understand that they are different but not weak, so that they are not suppressed upon.
Thank you so much, ma'am.
Thank you.
Thank you so much. Do we have any other questions?
Good morning, everyone. This is Neeta Virmani from IP College.
Yes, ma'am.
I really don't have a question. I think, Dr. Shubhangi, your session was really self-explanatory, and the
Thank you
questions
so
were actually
much.
cancelled as you were going on. I have three important comments to make to you.
Yes.
Firstly, you really justified the Autism Awareness Day. And I think whatever we have been discussing and knowing about autism, you helped that fall into right places, and it was really reaffirming. So thank you so much for making your presentation so comprehensive and so well adapted to people who are engaged in this field of child development and disability. The second thing is that I really look up to you, Dr. Shubhangi. You are a perfect combination of a medico engaged into developmental disabilities, because I mean, we all understand that we have to follow an integrated approach and all functionaries and stakeholders have to come together, but rarely that happens, right? Especially in country like ours, where we are so much demarcated into different departments. So when I hear you, it really I mean, makes me happy as a pedagogue of human development that we have people like you whom we can look up to you, and you can really serve as a great resource for us and for our students. So thank you so much again for that.
Thank you.
And lastly, I think one flagship point of your presentation was the strengths of people with autism. Trust me, I have not been through that. I have been a student of child development. I have been teaching it since 10 years now, but then I never discussed it with my students. Neither I think my teachers discussed it with me, that how they are so, I mean, what are their strengths? I mean, we always discuss on working with them, working for them, but then rarely we understand that they have so much to give to us. The way they follow order, the way they won't beat the bush, and the way they won't focus on to all other characteristics. They won't be sarcastic and satirical in their comments. So thank you so much for that. I'm really glad, that I was a part of this presentation, and thank you so much. Thanks, Dr. Shubhangi. God bless you. Yeah, thank you. Thank you.
Thank you so much. I hope you've all enjoyed this insightful session. Before leaving, please fill the feedback form which is in the chat box. I would really like to thank our principal ma'am, Dr. Sadhna Sharma, for giving us this opportunity to gather today. I, on behalf of Shama Prasad Mukherjee College and the entire Family Counseling Center team, extend a warm vote of thanks to Dr. Shubhangi Gupta for sharing her valuable words and information on the special occasion of World Autism Day. We loved how you highlighted that ASD is not an end to everything. Thank you for sharing the strengths of people with autism, and thank you for sharing how can we communicate with them. I would also like to acknowledge our gratitude to students and the prestigious faculty members from different colleges who have joined us today. Thank you for taking out time and joining us. Thank you so much, everyone, to be a part of this special talk. Now I request everyone to please fill the feedback form. Thank you so much.
Still, if anybody wants to say or ask something, maybe we can. Floor is still open.
Yeah, I would like to take this opportunity to thank Dr. Shubhangi Gupta. It is really a very enlightening and warm talk. And I hope all the participants here are enlightened by the information that you have shared. You being a young enthusiast working in this direction, God bless you. Take care. Thank you so much.
Thank you so much, ma'am. Thank you so much.
Shubhangi, this is Dr. Ashima Sharma from one of the members of FCC. And when Suparna ma'am, suggested that, okay, this Autism Day is coming and she has to suggest, so we were actually, very excited about. And believe me, after hearing this 1 hour session, the complete perspective I hold as a teacher, into this field also teaching has changed. And it has also led me, that it is beyond, the negative points and even the strength and the weaknesses, which, the strengths which is the underlying, parameter and the perspective which we are not, aware of. I think we should mobilize more into this channel, and thank you so much for, taking out time and making us aware, and, work something more on it with, with the new perspective I think we all have, got through from your talk. Thank you, Dr. Shubhangi.
Thank you so much.
Thank you so much.
Thank you.
And meanwhile, when children are filling up the forms and everything, faculty members, the feedback form, can I suggest if we can have, video on, so that we can have a picture for our memorizing as a purpose. If we can switch on your cameras, please.
Sure.
Thank you. I would request all the participants. Thank you so much.
Ashima ma'am, I'll take the group picture.
Yeah, if I can, but there is still few to go. If we can, probably they're filling the feedback form, so we can give them a minute to do so, and then we can take it. Okay. Thank you.
Thank you, everyone. Thanks.
Thank you, ma'am. Thank you, ma'am.
Thank you.
Thank you
Bye-bye.
everyone for
Thank
attending.
you.
Thank you.
Thank you.
Ashima, Dr. Ashima.
Anji ma'am.
Are we also supposed to fill the feedback form? I don't think, na.
No, ma'am, I haven't filled.
Yeah. All right.
Yeah.
It is for students and other faculty.
Yeah, the other faculty members, right, ma'am.
Right.
दिव्यांश कपड़े पहन, क्या नहीं क्या?